Hello lovely people, welcome back to my channel. You can call me Experience One. My name is Abdul Malik Mohammed. Today we are going to look at breast cancer. Please, if you have not subscribed, kindly subscribe and then hit on the notification button for all our videos in case when we post them. Now we are going to look at breast cancer. In recent time there has been breast cancer awareness. So it means that it's one of the conditions that we have to pay a major or serious attention to it, because if you don't do it, women have a very serious challenge. Not only women, everybody, in as much as you are born with breast tissue, definitely you are likely to have breast cancer. So it means that not only women have breast cancer, even men can also have it. Now, breast cancer is a kind of cancer that begins as a growth of cells in the breast tissue. In fact, let me just say this thing. Whenever it comes to cancer, okay, it means that the cells has been replaced with an abnormal cells. Meaning, whenever a true cell has been replaced with an abnormal cell, that is very bad. In fact, God created us differently with the true cells that give us all the functions of the tissues and the skin. So whenever this particular cells has been replaced with a false cell and they start spreading out, that is when cancer are formed. Meaning the function of these particular cells are going to be reduced drastically, meaning or no function at all. That one way or the other will tend to cause a very serious trouble in the body. So that means that cancer is something that we are not supposed to play with. So and you said that anyone born with some breast tissue. So anyone is born with a breast tissue, and so it means that anyone can get a breast cancer, and of course anyone can get it. It is classified as invasive when it penetrates the tissue surrounding the mammary ducts and grows in an irregular pattern. So that should tell you that we can classify this as an invasive whenever the mammary duct is penetrated. So that is very bad, very, very bad. Okay, so that is what we mean by the breast cancer. Now let's look at the common site. The common site of breast cancer has a target. I always say this thing. It has a target. So one of the targets is bone. So when you have a breast cancer, there's a likelihood that the bone can be affected, and then the lungs. Of course, the lungs are behind the breast. So it means that whenever you have a breast cancer, there's likelihood that they can metastasize, or they can spread to these areas: the lungs, the brain, the liver, and the bone. All these things are the targets that the cancer can spread to. And you know that blood-borne is the commonest spread when it comes to cancer. So through the blood, it can get to this, or can get access to these areas and cause a very serious effect in the body. Now, the cause is actually unknown when it comes to breast cancer. Causes is actually unknown, but there has been a risk factors, things that can lead to breast cancer. Age is one of them. Age, as you age, definitely your cells start to degenerate. So it's one of the things that can lead to breast cancer. And then family history of breast cancer. Family history of breast cancer. If you have a family, you come from a family where breast cancer is a common thing, then you know that one or the other you have to go and take off your breast, especially after childbirth, in order to be secured. And also early menarche and late menopause. People or some individuals, they have their menstruation at the early age. For instance, 10, 11 years they have menstruation, and then or if you also have menopause at the later part of your life, that is also one thing. So early menarche has to do with early menstruation, and then late menopause talk about late menopause. So that means that from this moment, for instance, after 35-40 years, that's when the individual is having menopause. You are likely to have breast cancer. It's the common risk. And also previous cancer of breast tissue. If you have ever had a breast tissue cancer before, it means you are likely to have it. And then uterus or ovaries. So if you have ovarian cancer or uterus cancer of the uterus, there's likely that you are going to have breast cancer. And then also nulliparity. People who have not given birth before. Okay, people who have not given birth before, okay, they are also likely to what? To have breast cancer. And late first birth. And then also the individuals who don't give birth early. People who don't give birth early. At the age of 35, you're now giving your first child. Giving birth to your first child, is also one of the things that can lead to, breast cancer. So take important notice to it. And then also obesity. Of course, obesity is very bad, as we know. And then high dose radiation exposure to the chest. Okay, radiation, exposure to radiation. For instance, the reason why you are supposed to use the lead shot anytime you are going in for chest x-rays and some form of radiations. It's very bad because there's likelihood that the cells can be manipulated with the four cells, thereby causing it function to reduce, and then cancer is one of the things that can happen. So let's take important notice to that. Let's go and look at signs and symptoms or assessment. In NCLEX, we say assessment. Okay, so what will be the assessment of breast cancer? There's going to be a mass. A mass is going to be felt during breast self-examination. Whenever you are doing self-examination, in fact, we are going to talk about breast self-examination. Okay, how to examine your breast. Okay, so we are going to talk about it. And usually, this is felt in the upper quadrant or upper outer quadrant, beneath the nipple or in the axilla. When you do the breast self-examination, these are the areas where you are going to find, okay, that this particular mass or the breast cancer. So when you do the breast self-examination, and then presence of lesion on mammography. In fact, mammography is one of the diagnostic tests when it comes to breast cancer. Okay, so we expect every woman, okay, in his or her childbearing age to regularly go for mammography, especially when it comes to the yearly intervention. It's very important. And then there's going to be a fixed irregular encapsulated mass, which is painless except in the late stages. Okay, so the irregular encapsulated mass that you are going to feel, what happens is that it's not painful. Okay, with the exception that during the late stage, okay, the end stage of the cancer, that was when you start feeling the pain. So it's one of the things that let us know that you have a cancer. It's one of the signs. So take notice of that. And then asymmetry. When you look at the breast, you see that the breast will not be in line. Okay, it means one will be larger than other, or one, okay, will not be, okay, in the same position as compared to the other. When you try to measure, that should tell you that, okay, the breast cancer is manifested. Asymmetry. Take note of that. And then bloody or clear nipple discharge. If you are an individual who sees some particular unusual discharges from your breast, whether a clear or maybe a blood coming from this area, please go for checkup. It might be a breast cancer. So take notice of that. And then also a nipple retraction or elevation. When you look at the nipple, okay, it will be retracted. Okay, well, this is one of the serious or dangerous signs when it comes to breast cancer. In fact, in NCLEX, you'll be seeing similar things like this in the questions. So take note of that. So retraction of the nipple. And then the skin dimpling. Okay, the skin will be the what? Meaning when you look at the skin of the breast, like it is getting inward. Okay, dimpling of the skin of the breast will happen. And then retraction or ulceration, meaning there will be some kind of ulcer, some kind of wound that will be formed on the skin of the breast. All these are indication that you have a breast cancer. So let's take important notice to that. Skin edema, swelling of the skin of the breast, or peel the orange skin. Okay, peel the orange skin. Okay, it's all edema of the skin of the breast. Axillary lymphadenopathy is going to be present, and then peeling of the skin or scaling. The skin will start peeling off. Okay, so when you look at the breast skin, it starts peeling off. All these are indications that the individual is having a breast cancer. Let's take notice of that. In fact, when you contract the breast cancer, what is the management that can be given to these individuals? Of course, we have already said that when it comes to the diagnosis, mammography is what we do. So always go for a yearly checkup when it comes to this as a woman. And then let's look at the management. chemotherapy is what we do, and then radiation therapy can also be done. We can also do surgery. Okay, we can also do surgery in order to remove the breast if it has not what metastasized or it has not spread it to other areas. We can do surgery in order to reduce the effect of the breast cancer. So we take notice of that. Let's look at how we can be able to prevent breast cancer. Prevention of breast cancer. Ask about breast cancer screening, like the mammography we spoke about, is very important. Mammography is very, very important. Don't underestimate that point, and then become familiar with your breast through breast self-examination. You have to be checking every month. Okay, you have to be checking your breast to assess it, to see if there's an what do you call it, if there is some unusual changes, okay, within the breast. It will help you to identify it. Okay, so that means that familiarity of your breast tissue is very important. And then avoid alcohol intake. Exercise most days of the week. Exercise is very important. Okay, like 30 minutes exercise is something that you are not supposed to joke with. And then limit menopausal hormone therapy. Now, let me just digest this. Menopausal hormone therapy. You know, those who don't want to age, because they think that, oh, when they go into menopause, okay, there will be some particular signs and something that they will go through. So because of this, they go for some particular hormones, hormonal therapies. So they will inject themselves, or they'll be taking some hormonal pills in order to what? To nourish their system so that they don't degenerate, they don't get old. These particular hormones have a very serious effect on your system, and it can cause what? Breast cancer. So let's take notice of that. Limit menopausal hormone therapy, as we said, and then maintain a healthy weight. Maintain a healthy weight, meaning you have to do exercise, and then you don't go beyond the basal metabolic rate, the BMI. Don't go beyond. It's very important because of what? Obesity. And then we are also saying that maintain a healthy diet. Maintain a healthy diet is very good, and using estrogen blocking medicines. Example is selective estrogen receptor modulators and aromatase inhibitors. Okay, so using this particular, estrogen blocking medicines can also lead to a breast cancer. So you have to what? You have to what you're trying to let you know is that you have to use a type of hormones, okay, a type of medication that has ability to what? To block estrogen, okay, in order to reduce the effect of breast cancer. So you have to use an estrogen blocking medications. Okay, example is the selective estrogen receptor modulators, or and also the aromatase inhibitors. This is very, very important. So that comes to the end. Okay, the next video we are going to talk about how to examine your breast. How to examine your breast. So breast self-examination. And as a woman, you have to do this. Okay, wait for the next video or part 2 in order to help you out. Thank you once again. Please, this particular content is sponsored by American Dream NCLEX Prep. If I contact us for all your NCLEX needs, so take notes of that. Please, once again, can you subscribe to our channel and then share it for people to get to understand and then know what is happening here. Thank you very much once again. Have a nice day. Bye-bye.